what's going on with Ebola?
Well, I think we needed to bring them forward, and I was glad that they did, and I know it was not easy for them to do it because we are still across this country hearing, and as we heard from Dallas Hospital, that, you know what, we're ready. We can take any patient that comes in with Ebola. And I think, you know, then the finger pointing that, oh, the nurse must have broke protocol, and this is why this happened. And the issue is, no, you just did not, you were not and are not prepared to take these patients. There is a higher level of what these patients require for care as far as protective equipment and as far as training, and we did not do it. And the concern we have is that, you know, Dallas can be repeated in any hospital, and especially, I would say, the vast majority of hospitals in this country who will continue to say they're ready and will put us in the same, you know, into the same situation unless we take this on and you know, make sure that everybody is trained and getting the best equipment we can possibly give them.
After news emerged that Nina Pham had contracted Ebola, Thomas Frieden, the director of the Centers for Disease Control and Prevention, said the transmission was the result of, quote, a breach in protocol. Let's go to a clip.
We don't know what occurred in the care of the index patient, the original patient in Dallas, but at some point there was a breach in protocol, and that breach in protocol resulted in this infection.
Frieden later apologized for suggesting the nurse was at fault. We haven't heard anything from the doctors there. Karen Higgins, can you respond?
Well, I think that, you know, unfortunately, everybody is trying to not respond. I think, you know, out of fear more than anything. But I think that, you know, he was wrong to make that statement. And it is a system problem, but it's a system that is going to be a problem unless we do something more to give us a actually standard of practice that we do with all of these patients. This can be contained. Atlanta contained it. They have had no breach in any of their protocols or had any spread of the disease, and they've been taking care of patients. So we know it can be done if it's done right. The problem is, as we're ready in every hospital, no, they're not. And the nurses are very clear on that. And then I think you'll even hear more when people are on tonight talking about it. They don't feel ready. They don't feel they have the equipment. And on top of it, the most important thing is I need to be trained, and I need one-on-one training. I don't need an email. I don't need a videotape. I don't need a memo. I need one-on-one training, and I need to know that when we're removing and putting on this equipment, we're doing it safely, but that I also have the equipment that keeps me safe. And that is not just for nurses, but for all health, you know, all employees that have to have any contact with this patient.
And Karen Higgins, I'm wondering if you could comment on some of the allegations of the nurses and what actually happened in the days when Thomas Eric Duncan was at the Texas hospital. They talk about the fact that he came in an ambulance. This is the second time he'd come to the hospital with his family, saying that they believed he had Ebola, and yet he was kept for hours in the emergency room among other patients, not isolated immediately. And even when a nurse supervisor complained and said he has to be put in isolation, that there was resistance from her supervisors to that. They talk about hospital supervisors coming in and out of the isolation unit without proper protection. They mentioned that the specimens for Mr. Duncan were sent through the tube system of the hospital to the labs rather than being properly sealed and delivered, hand delivered to the lab, which could possibly contaminate the entire tube system of the hospital. And also, what you mentioned about training, they say that the only training that was offered to them prior to this was a voluntary training, not even a required training, and it was largely just a seminar like any other seminar that they're given at the hospital. The importance of these lapses in terms of what now seems to be the spread of the virus to at least 2 health workers and maybe more.
Well, I think that, again, it was a perfect storm. It was set up that, you know, the hospital says we are ready for infection. Well, we are ready for infection. We're just not ready for this kind of infection. We were not ready for Ebola, and we were not ready with the precautions that are actually needed to isolate these patients. And it's really you know, frustrating, and we are angry. We put, you know, everybody at risk when we don't do things right. And they did not do things right. They did not do the proper training, which is the biggest piece to this. If you train the nurses, if you train healthcare workers, not only to be able to pinpoint that somebody has that disease, but to pinpoint that you can isolate them and put them on precautions and do everything you possibly can, wearing precautions to take care of that patient, this would not have happened, and it did happen. And as I said, you know, we're hearing from nurses across the country that, you know what, it would be the same scenario, that they're not doing enough training, that there is a level of infectious disease that we've always done training for, but not to this level. And if we're going to see the possibility of having another patient that has Ebola in another hospital, we have to up the game. We need to be able to take care of that patient way beyond the level that we have our normal training at. And, you know, we need the guidance, not just the guidance. We need a standard of practice so that if we know it from this point on in every hospital, and not, you know, just accept the fact that they keep saying we're prepared, but we need to mandate that they have a certain level of care, that they have a certain, you know, a level of equipment that is the safest equipment we can use, but that we're also invested in doing one-on-one training, that we're doing it one-to-one, that we are repeating the training, that we are doing drills, that we are doing everything we possibly can, not only to protect those that are taking care of that patient, but to make sure that this never happens again and that somebody else gets infected inside of a hospital because they were taking care of somebody.
I want to turn to comments made by Marla Weston, the CEO of the American Nurses Association.
We do know is that the process of putting on the protective equipment, taking off the protective equipment is really detailed and must be done rigorously each and every single time. So I think it's important for us to understand exactly what happened. Did something go wrong, or is the protocol need to be modified? So until we really know exactly what happened, it's hard for people to know how to fully protect themselves.
Your response, Karen Higgins.
Well, I mean, you know, again, I mean, I think people were waiting to hear what went on. I'd hate to say that most nurses are not surprised at what went on, that they did not have the proper equipment, that there was no real training. And I appreciate now CDC stepping up and saying that they would bring, you know, people in if somebody is diagnosed with Ebola. But again, that's not enough, because we need to be on top of it before that. CDC can be there in a few hours. Well, you know what? There's going to be a period, a few hours where somebody has to be actually picked up that there's a concern that they have Ebola. Then they need to be isolated. All of this should be already going into effect before CDC arrives, and then it would be very helpful to CDC to help them progress from there. But you still have to be prepared for somebody coming in. And most hospitals in this country, again, other than maybe Nebraska and Atlanta and a few others, nowhere are we nearly prepared to take on this issue. And we need to step the game up, and we need to mandate that you do the right thing, and you do what needs to be done, and you provide the equipment, and you provide the education. And you know what? We can isolate this. We know it can be done. We've seen it done in Atlanta. We've seen it done in Nebraska.
Nebraska's treated a few Ebola patients and have had no health care workers come down with illness, and the patients are all getting better.
That's exactly it, and the same goes with Atlanta. So we know it can be done. We just need everybody to make a commitment, and we need CDC to make a stand that we are following, the same kind of protocol as far as equipment and actually the rigorous training, because it is true, taking it off and putting it on. And what they recommend is not only having the good equipment, but they have somebody else always be with that person when they're dressing and when they're undressing to make sure that they are safely doing it.